Bismillahirrahmanirrahim. Dr. Tariq Rafi, Chairman, Higher Education Commission Sindh, Dr. Farhat Abbas, Dr. Nusrat Shah, Dr. Amjad Siraj Memon, Professor Dr. Gulshan Ali Memon, Dr. Syed Rasool, Dr. Masood Javed, the expert speaker, and our host, our facilitator today, Dr. Nigat Shah, the faculty and doctors of Jinnah Postgraduate Medical Center, the young researchers, leaders, ladies and gentlemen, Assalamu Alaikum. I got a call a couple of days ago to come over to this conference, and I just had to make time. I'll tell you why. It was my own interest. I wanted to come to JPMC and talk about what together, along with the private sector, we've been able to do for the 3 hospitals that were taken over by the government of Sindh in 2012. In addition, I wanted to learn a little about the cutting edge technology that your young researchers are working on, and I'm so glad that I accepted this invitation and I'm here today. So I'm really honored for you to have invited me here. Before I go to the topic, as I said, I'd like to talk a little about what we've been able to do in the last 10 years or so since these institutions were moved to the provincial government. As you all know, the Jinnah Postgraduate Medical Center, the National Institute of Cardiovascular Disease, the National Institute of Child Health were with the federal government, and after the 18th Amendment they were transferred to the provinces. At the time of transfer, the total bed strength of these 3 institutes was 2,092. And mind you, these started operations in the 60s, if I remember correctly. These have been doubled, almost doubled to 4,041 beds in the 3 institutes now. And we plan to expand this further, and we plan to take it to 5,000 beds, the 3 institutes, which comprise of this cluster of medical facilities that we have here. And to make this, I'm told that this will become the largest healthcare facility of Asia. And if it's of Asia, I'm sure it is the world. Because I don't know, Asia, do we include China in this? If we do, or India obviously has to be included. So, okay, even if it's not the largest, it's big for our country. At the time of devolution, the total budget of these 3 institutions was 1.9 billion rupees. Last year, the year that we're ending now, we've crossed 25 billion. And I'm going to talk about what Dr. Tariq Rafi said. One thing I did not sort of foresee was that this visit is going to cost me 10 billion rupees. I got this summary yesterday and I'm still thinking about it. But, obviously the government of Sindh has been supporting higher education, has been supporting the universities, and will continue to do so. We've added cutting-edge technologies here at Jinnah Postgraduate Medical Center, at NICVD. NICVD now does, I'm not an expert, I'm just a subject of your doctors when we're not well, but they are doing stroke procedures which nobody else is doing in Pakistan. At JPMC, the radiology center that we have, we've got the cyberknife, tomotherapy, and other modern machinery that we're using here. And apart from this, these are the 3 hospitals here. I can go on and talk about what the government of Sindh, and I'm very proud of it. That's why I like to talk about it. What government of Sindh has done in especially the tertiary healthcare in this province. Talk about SIUT, talk about the Government Institute of Medical Sciences. They're all very success stories. and our resolve is to take them even further. Coming to the topic today, this was the last century, long time ago. I went abroad to study, and I myself got interested in AI. This is a long time back. And I actually took a course with a professor there. I'm a civil engineer, so a civil engineering construction management professor who was doing some research. And the first thing I had to do was, I don't know if Dr. Masood Javed would know this, I'm talking about the last century, so this technology of almost half a century ago. First thing that they asked me to do was learn a computer language called Lisp, list progression. I don't remember any of it right now. And at that time, I was part of a small research where a Chinese student, and I remember his name because I can never forget his name. His name was Chuha. I can't forget it. So he was doing a research along with the computer science, and I was, he was a PhD student. I just started off, and he was doing a research on these self-driven construction equipment, excavators, loader trucks, and he would have this model where he'd have sand dunes, and he'd have these machines, driverless, learning from other drivers and trying to do it. And I'll tell you his point of view. A couple of months down the line, he suddenly said, I'm not going to do this project. And he told the professor that, sorry, I'm not going to do this project anymore. I said, why? He said, you're going to put so many workers out of business, out of work. And China has a population of 1 billion at that time, if I'm 1.1 billion, and all our workers are going to be out of business. So that was one scare that he had. But then obviously you have to keep up with technological advancements. You have to learn. One thing that I'd like to tell you is that as a patient, I'd rather see a doctor than a machine. I hope that you all are not replaced by machines and we have to go and sit in front of them. I'd like somebody with emotions who'd know what my pain is like, and don't teach the machine what pain is like, because then, if all of us here go to our preferred doctors, all doctors are very good. When you go to a preferred doctor, because you like, even if he doesn't treat you properly, but his attitude towards the patient matters. So I hope that part doesn't go away when we have these machines treating us 10, 20 years down the line, and that human touch or the human sentiment is there. So with that, I've just very briefly went around what the students have done. Very, very impressive. I congratulate all the students for the excellent work that they're doing here. As Professor Dr. Syed said, we have increased the number of postgraduates from 400 to more than doubled them in the last few years. And just a word of caution, the postgraduates that are working here, we've had problems with them in the past. Please, doctors are not supposed to, doctors are supposed to be people who'd, you'd only go to a doctor when you're in pain. So you have to have your patients or the people who come to you recognize that they're in pain and work accordingly. But the excellent work that is being done here at the JPMC and the other universities in the province of Sindh, we're very, very proud of it. And inshallah, we'll work with the JPMC, with other educational institutions to promote research, to promote modern technology coming into the medical profession. And what are we doing here? I've got Dr. Tariq Mahmood sitting right here, and we've been working with the Patient Aid Foundation for a very long time, and this is an excellent example of public-private partnership. And I'll acknowledge that they were the ones who took the lead, and we followed, and we're trying to match their pace. It is difficult, but I think we've been fairly successful till now. What we've been doing at the JPMC along with the Patient Aid Foundation is that we've engaged a world-renowned company, Pexera, for installation of PACS and artificial intelligence system at JPMC. They are going to install the same system that is installed at the Johns Hopkins Hospital and the Harvard Medical School. Inshallah, JPMC will be the first public sector hospital to have artificial intelligence, which will not only improve the patient care, but also provide the access to data for research and to develop our own protocols for different diseases. And I've been told something are very difficult to believe, but I'm sure very credible people are telling me this. So this is right. We, in the province of Sindh, it will be the first time outside the United States of America that advanced AI technology will be deployed to make predictive algorithm-based and trained on local Pakistani population and disease patterns. So the actual subjects will be local Pakistani patients, and because genetics, I'm not an expert, but obviously we have different diseases than the ones in the West, and there are different treatments for us, and we need to learn from our own patients and learn from our own prognosis of diseases that we have in this country. Inshallah, after the JPMC, we'll have AI models in other institutes also, and I encourage all institutes in the province to come forward and give proposals to the provincial government to use this modern technology, because we can't be left behind. Obviously, I've made certain observations regarding what we should not be doing in the future. This is my view. I may be completely wrong, not an expert. You doctors, you researchers are the ones who would lead us, and I assure you that the government of Sindh will provide you with the utmost support under the constraints that we have. One last thing, as Dr. Tariq Rafi pointed out, I'd want to say this. A couple of days ago, 3 or 4 days ago, we've learned suddenly that the federal government is stopping. I know the federal government is under a financial crunch. We are under a financial crunch. We've got problems. But we can't, and this is what had happened in 2012 also, and I'll tell you about that story too. I'll just go to 2012 first. In 2012, at that time, I was the provincial finance minister. We made a budget. At that time, even 1.9 billion rupees was a lot of money. We made our budget, and suddenly we found out that the federal government had not allocated any funds for these 3 hospitals in Karachi, the NICVD, the JPMC and the NICH. And the finance secretary came to me, I remember it was the 6th or 7th of July, saying that we have a whole of, I don't remember the exact amount, but it should be around this 1.9 billion or 2 billion rupees that we have to fill in, because they've not left with, these hospitals don't have any money and they can't function. The chief minister then was very kind. We took it to him, the health department and the finance department, and he approved this additional 2 billion rupees outside budget. Normally, outside budget allocation is not done in the first week of the financial year. We had to do it. And this time around again, they've given us some advance notice. But again, the almost 12 billion is what they were giving the Sindh hospital. This is in addition to the 32 billion that the HEC has recommended for the universities, because they took into account the 11 billion rupees that were coming from the federal government. And 4 or 5 days back, we were told that they're not going to give us any money. And this is going back on their commitment, because under the National Finance NFC Award of 2010, they had committed that they will continue funding the universities till the next NFC. The next NFC is not yet. So, saying that in the next National Financial Commission Award. We're going to increase the province's share so that they can take care of the universities. But till then, we will continue funding the universities. The first thing, the first thing that they did to go back on their words was they froze our allocation to 2011. So that was it. Not talking about the three hospitals here, they withdrew those completely, and the budgets did not increase. So that is why we started off with 5 billion rupees about 6 or 7 years ago, if I remember correctly, to supplement the universities in Sindh, and now we stand at more than 20 billion rupees this year, because there's no way these universities can function if we don't support them. And suddenly this year there's another hole of 11 billion rupees from the federal government. And I take this opportunity because I'm sure this would go on. This is not acceptable. We will not accept it. I'm going to write to the Prime Minister to continue funding at least at the levels that they were doing earlier. If they're not increasing, at least they should continue funding at the levels that they were doing earlier, and provide the necessary funds for our universities. With this, I'd like to end my talk here today. I'm sure, I don't want to bore you any further. You'd like to learn more about AI and the advancement in the health sector. So once again, I thank the organizers of the second Postgraduate Research Conference for inviting me here today. It's an honor for me, and I'm grateful that you all listened to me so patiently. Thank you very much. Pakistan Zindabad.